I've bought myself a present, and for the clinic too. It's a pelvic wand. So this one's from Intimate Rose, but I have bought them from different companies before. There was a brand called TheraWand. So a pelvic wand is really a silicone usually or plexiglass that you can utilize to help release your pelvic floor. And it should have this curve. So I thought it'd be fun to open it together. So I have already slit the plastic. And let's see. There we go. These TheraWands, these pelvic wands, can be used for if you have pelvic pain, you have a lot of trigger points. And you want to be very careful when you're using this. So you may have been told by your gynecologist or maybe from your pelvic floor therapist that you need to get one. So as it comes in, there's a little card there, coupon, and there are some videos online that you could watch to help you with this too. But really it's something that many of my clients have used. What have we got in here? Okay, we have a little bag for it as well. So you can have that discreetly in your velvet pouch. And then you have the instructions as well. So there you go. And the different ones that you can buy. So I've got myself a nice pink one. This is the most common one that people use. It's not terribly big. It's a nice soft silicone. And you have two ends. So you have a very thin end here for people that have a tight vaginal opening. Same with this one. It's also a little smaller than a instrument or a toy that you might use, or your partner's penis. So how are we going to use this? Well, I have my pelvis here and I thought we could show you. So I've got all my little organs here. So why don't we just take them out because they're just kind of going to get in the way. Now, pelvic floor musculature. We have the superficial and we have the intermediate muscles, and then we have our deep muscles as well. And when there is something called vaginismus, it's going to be quite tight at the entrance. So you probably will want to use this smaller end. So it's even smaller than my finger. And you can place this gently into the pelvic opening, the vaginal opening, and press down. So people say, how long do I push into a tight area? Anywhere from 60 to 120 seconds. And that way you've given enough time for that muscle to release. If you find that you have a lot of pelvic burning, say if you have something called vestibulodynia or vulvodynia, but you might find it burns and it gets worse as you do this. As you release, it actually gets worse, then stop. This might not be for you, or it might not be the time for you to do this. You might need some medical intervention first, or seeing your pelvic floor therapist for some desensitization techniques. So you don't want to aggravate the area, so you're going to be very gentle. Now, a lot of the times we can actually use this end, and it's tapered, so it's a little easier to get it into the vaginal opening. You can also do a pelvic wand into the rectal opening. I don't tend to recommend that with my clients because the rectum's fairly thin versus the vaginal walls are very thick and can withstand a bit more pressure. So we tend to start here and go from there. So when we go into the pelvic floor, I have another little diagram here. So you can see the different pelvic muscles. So what this represents, this would be your back and your sacrum, and this is the front of your pelvis. So you would go into the vagina with your TheraWand, and you can, like I said, you can go in with the thinner end and then turn it towards these more intermediate muscles, or you can go slightly deeper and then start pressing on some of these deeper muscle systems. Again, I would recommend to start probably 10 minutes or so. If you think about each trigger point taking about 1 to 2 minutes to release, let's say you do 5 or 6 trigger points, so muscle knots in about 10 minutes. You know, if you can only manage 5 minutes, that's fine too. Don't press towards the bladder, so that would be straight ahead, so straight in front of you, nor do you press straight back onto the rectum. So you're trying to press into the sides of the muscle system. We don't want to put a whole bunch more pressure straight onto our bladder. That it's very uncomfortable, it hurts, and don't want to harm yourself. And the same thing, pressing straight back onto the rectum. And be gentle with yourselves. Number one, be gentle with yourselves, please. Okay, you don't have to be tearing things around in there. Now, the other one is this end, which is a little bit, I think, a little more practical if you can get to this. It'll help you stretch out those tissues, and then you can hold it there. So how long would we want to hold? Maybe, again, 1 minute, 2 minutes, 3 minutes if you can tolerate it, if you're using almost like a dilator to stretch out the tissue. Sometimes we'll start here, then use this end, and then we'll actually go into a dilator that has a larger dilator. I will do another video on it, but there is an a tool to use into the vagina to help stretch out tissue so that you can accommodate a penis or other things that you may be using. So yeah, I think this is a great tool. You don't have to do sit there and do 15-20 minutes at a time. Just start off, try and find a couple of trigger points. So when they feel sore. So like as though you're pushing into a knot in your neck. You'll think, oh, that's a sore spot. Well, you put your wand against that sore spot, and after 60 to 120 seconds, that discomfort should start resolving. So it should not be as painful. Then you go off of that one, and then you gently find another one. If you can do 2 or 3 points each side, each day, that would be great. Or, like I said, you might just start at the entrance and do a little bit of releases at the entrance to start working on the more superficial muscles, more of these, so that you can access the deeper muscles easier. All right, that was pretty fun. Now I've got this to bring into the clinic to show my clients. And I hope that helps. And there are, like I said, other videos that you can look online, but don't make it too onerous for yourself. If you just start off with a few minutes and get used to using your wand and get comfortable with using it, and use it daily, ideally, until you have a little more pliability and flexibility so it can make your pelvic floor more comfortable.